Today, we're talking about something that's honestly super important for anyone managing a long-term health condition. We have this idea that treatment is a one-and-done deal. But the truth is, managing your health is an active journey. Your plan has to evolve right along with you.
So let's kick things off with a question. Your doctor gives you a prescription for a chronic condition. Is your work done? I mean, it's so common to think, okay, set it and forget it. But that can be a really risky way to look at your long-term health.
You know, when you get a diagnosis for something like diabetes or hypertension or high cholesterol, it's easy to see it as some kind of finish line. But really, it's the absolute beginning of a managed health journey.
Yeah, this really gets the idea across perfectly. Think of your health plan like a route on a map, and the destination is, of course, better health. But that path might need to change, and being proactive is the key to navigating it all successfully.
So why does the route have to change? Well, a treatment plan that works like a charm for you today might not be the best fit 6 months down the road, and there are some really clear reasons for that. It all boils down to this one simple but incredibly powerful fact. Your body isn't some static machine. It's a dynamic system that's constantly adapting and responding to everything, both inside and out. And what's really interesting here is just how much everyday life plays a role. Take stress, for example. It's not just a feeling, right? It actually floods your body with cortisol, which can directly impact your blood sugar and how you process medication. A shift in diet, the natural process of aging, or even a new medicine for something else, all of these can alter how your body responds. This is exactly why regular monitoring is so crucial.
This quote from the source material just hits the nail on the head, and the key word here is silently. You might feel totally fine, but under the surface, things could be changing. And if those changes go unchecked, they could lead to complications later on.
So the point isn't about looking for problems, it's about staying in the driver's seat. Regular monitoring lets you and your doctors see if your treatment is actually working, catch any side effects super early, and really fine-tune your medication just for you. It's all about keeping that steady, consistent control.
Okay, this all sounds really important, but how do you actually know when it's time to check in? Well, this next part is a super practical guide with clear signals that it's time to book that review with your doctor. I want you to think of this next bit as your own personal health checklist. It's a tool that really empowers you to figure out if it's time to have that conversation about your treatment plan. Let's just walk through these triggers. Have you started or stopped any other medicine? That's a big one. Noticing new things like fatigue or dizziness? That's a clear signal. Are your home readings for blood pressure or sugar looking different? Your doctor definitely needs to know. And hey, even if everything feels great, a regular check-in every 3 to 6 months is just smart for staying in control.
Okay, so you've made the appointment. What actually happens during one of these reviews? Let's kind of demystify the whole process so you know exactly what to expect.
First things first, a medication review. This is basically a comprehensive safety check. Your doctor's going to look at everything you're taking, prescriptions, over-the-counter stuff, even supplements, just to make sure they're all playing nicely together and doing their job safely.
Next up, dosage adjustments. Now, this doesn't mean something's wrong. Actually, it's a sign that your care is being perfectly tailored to you. Based on your latest tests and how you're feeling, your doctor can tweak your dosage to get the absolute best results. And it all comes together in this proactive approach to your health. It's a mix of checking your vitals, running some tests now and then, offering guidance on lifestyle, and making sure all your specialists are on the same page. Your doctor is basically a partner, managing all these pieces for your overall well-being.
So what's the big payoff for all this consistent management? Well, it's not just about managing a condition. It's about achieving a goal.
And this is the goal. The ultimate benefit here is stability, preventing future problems, and, most importantly, improving your quality of life. It's all about feeling confident and in control of your own health journey.
This quote really just wraps up our entire explainer so perfectly. Health management is a continuous process. It kicks off with a diagnosis, but it really thrives through steady, attentive follow-up. It's an ongoing partnership between you and your whole healthcare team.
So we'll leave you with this one last question to chew on. Your life changes, your body changes. The really crucial question is your health plan changing right along with you?